So when I saw a guy, what I saw was a person coming in with a cancerous prostate, not just prostate cancer. This was a person that was morbidly obese, highly functional with his weight, but still morbidly obese. And with a very high risk, not only of perhaps dying from prostate cancer, but even more so from a heart attack. And so once we started doing an evaluation and doing a clinical exam and a physical exam, we noticed we put him on a program. We call that program the Capless method. And the Capless method is a science-based, sustainable lifestyle program for our prostate cancer patients. And what it does is it puts the different elements in place in a structured way where we can try and create a hostile environment to cancer cells inside of the body. And then the other benefits are numerous. Cleaner arteries, the patient becomes fitter, better, the aging process significantly declines, etc. And there's different elements to the Capless method. One is what you eat. Okay. The other element is exercise. The other element is sleep and stress, and the other element is dietary supplements, which some you should take in some cases, and some others you should stay away from. And it's a little bit. There's a lot of confusion as it relates to diet, supplements, exercise. What should I do? Should I just walk briskly? Should I just eat more soy? It's a lot of confusion. So what we've done with the Capless method is really identify the dosage, the prescription of each element. So this is you need to have you should eat 5 walnuts a day, for example. Limit soy. You don't eat too much soy. You want to limit the amount of soy. You want to make sure that soy is organic because most of it is genetically modified and there may be some issues there. You just don't exercise. You exercise minimum 3 hours a week with moderate intensity. So when a lot of doctors just say, "Oh, just go exercise," well, what's the prescription? And if, for example, in a different case, when the patient is undergoing hormone therapy, they need to do weight-resistant exercise 3 times a week. So there's a dosage for everything. How much do I need to sleep every night? Well, the literature is very clear that actually you don't necessarily need 8 hours of sleep every night, but you do need between 6.5 to 7 hours of sleep every night. That's what we call the lowest therapeutic dose. Stress management. Can we go to the mountains and meditate for 2 or 3 hours a day? Well, that would be nice. But most of us don't have that luxury. So what's the minimum that I need to do to calm my body down so that my body doesn't create stress chemicals that promote cancer? Well, that minimum is about 20 minutes a day of deep breathing exercise, and it can be split up into 2 times, morning 10 minutes, nighttime 10 minutes. So this is a complete program where we identify the different mechanisms that causes cancer and kind of interfere and stop that process, that pathway from occurring. Same thing with dietary supplements, for example. Vitamin D3 is something that everyone should take. Supplements do not cure cancer. It's just part of the arsenal approach against cancer.